Thank you everyone for being here, for joining us for this panel on AgeTech, the headwinds, tailwinds, and unmet needs facing the global aging population. Before we start, I know my not so pretty face is on this panel, but there's a moderator who couldn't be here, unfortunately, Raisa, who had to fly home. She helped really put this panel together, bring together the investors, and set the outline. So I'm just going to be here helping execute her vision and staying out of the way. Before we get going, we'll have everybody introduce themselves quick. Let's do like a one-sentence intro on yourself and your fund mandate, what you focus on. And we'll start over with Gal.
Cool. Hi, everyone. Pleasure to meet you. I'm Dr. Noyman Wexler. I'm a partner at LionBird, early stage digital health fund targeting U.S. healthcare system and investing out of Chicago and Tel Aviv.
Right. All right. Here, I'm representing VU Venture Partners. VU Venture Partners is a generalist fund located in San Francisco and Hong Kong. We are a global fund to support futuristic transformative technology. I'll give you one more. Another fund, 1004 Venture Partners, is a new fund I co-founded. We are looking for transformative technologies for the healthy aging.
Nicole?
Hi, everyone. Nicole Walker. I'm an investment advisor with a handful of funds that focus on either biotech solutions or medtech solutions, but today I'm representing on the panel my board roles not only with the Alzheimer's Association, but also Rush Medical, and as a daughter who's been a full-time caregiver for the past year.
We have folks, investors here that wear many hats across different companies, healthcare organizations, and let's start kind of from the broad perspective. What is AgeTech? As we get into this, I want to set where the bumpers are and what the aperture is here, because I think it can be sometimes seen as very, very narrow, but as you start to widen the aperture of all the things that affect the aging population and go into healthy aging, it can get broader. So, Nicole, why don't we start with you in there?
Sure. I think you hit on it. What does it mean to age in the space that you want to and in the way that you want to? And so that, to me, is really AgeTech, and it can be anything from a service to a lifestyle to the housing choices that you need to make, and thinking that through along with your financial planning. It's really an all-encompassing, I almost think about it as just a transition. You've transitioned from being single to married, from maybe being a parent to an empty nester, and now as you continue to age, all those things that affect all of those components.
So not just age tech, I want to talk about aging process. So my thesis is healthy aging. I don't think aging is for the older seniors, actually. When you're born, your aging process just basically start. It's growth, and then you get old. So it's the whole process. We encounter a lot of changes in the body, mental, and then all kinds of environmental. We face a lot of different situations, and how we actually take care of ourselves. I see it as an aging lifestyle. So I'm not really talking about only the senior area. I'm also talking about the young juvenile who wants to grow, and then this also aging process. So all technology applied all throughout the cycle, in my opinion.
And let's double click for a minute on technology for an older population. Gal, focusing on the digital technologies for a moment, because there's many different types of technologies we'll touch on, but in the digital health world, what are some of the biggest opportunities or unmet needs you see that digital technology can solve, and maybe reference either some companies you've seen or been a part of, or opportunities you'd like to tackle in the future?
Yeah. So connecting to the definition, first and foremost, when we think digital, we need to think not only how we diagnose and how we treat conditions or life states and wellness in the third age, but also how we pay and consume the healthcare services, which is an important part. I think the opportunities are so diverse when you think about the fact that chronic conditions that people at these ages suffer a lot of the times from 4, 5, 6 different chronic conditions in the States. It can range from treating patients at home. We have a company, Heyday Health, that is a virtual first primary care for Medicare Advantage in rural areas where you don't have access to clinicians. Labor shortage is one of the major drivers of this space as well. Another great opportunity and a company connected to that is in the world of engaging these patients. So what's hard when you think about these patients is a lot of the time to drive engagement and behavior activation is very hard. We need that to influence clinical and financial outcomes. We have a company, One Step, in the world of digital gait analysis, the fifth vital sign, which is very, very critical for people in this age. And the way they do it is from using your mobile and passively. Why is it important? Because if you're trying to drive someone who is 80 and has challenges walking and he's at home, and you want to get an accurate assessment of his motor skills, you need the technology that will drive that change. So I think of the opportunities, it's so diverse, but really we need to tap into understanding how to influence these members and to factor in a lot of the times they will be at home and we will need to solve that issue.
Can I just add on one point to what Gal was speaking to? One of the biggest areas or opportunities I see is being able to connect all of the information that you have out here on a given patient. A lot of times we will discuss with our companies if there's a way for us to interact with the Veterans Association in the U.S. because it's such a rich one-stop shop for data because they essentially have an enclosed population. And I'll give you an example from my father's experience. They knew because of his exposure to toxins that he would have a 80% chance to develop hypertension, diabetes, Parkinson's, and dementia. His primary physician had no access to that data. So until his initial diagnosis, which took us 2 years to get to, everyone on his medical team was blind. Imagine how powerful you could be as an individual if you had insights to that much earlier on before you had any symptoms that you were trying to manage. And that's why I think as we look at these new technologies, having machine learning that can dip into these data sets, having better software tools that can connect different systems across the country, because it's rare that your specialist and your primary are in the same network. That's huge. And it gives a lot more flexibility in the aging process, no matter what your age is, to be able to make better choices. So that's where I think we really have a chance to be powerful as we think through these solutions and how to improve the overall care delivery plan.
Yeah, I want to come back to this idea of kind of connected systems and the care experience. But first, I want to double click on something you said, Gal, around patient engagement. Our previous company I worked with, a digital diagnostic and cognitive screening tool for Alzheimer's, and the data and the efficacy in a controlled environment, very, very strong. Tried to put it on a patient's smartphone in the home, and forget about being able to do the test. They can't open the app because this is a mild, moderate Alzheimer's population. As we try to bring advanced technology to a space where you're dealing with a patient population that might either be less tech savvy, you're dealing with a patient population where the patient is maybe not the only stakeholder. You have caregivers at home, children, other family members involved. How do we bridge this gap? How do we bring advanced technology to a space that needs it and get it in the hands of patients that need it in a way that they can use it?
So that one is actually takes more time. But I have one founder in my portfolio. She developed the RPM, remote patient monitoring. I actually hunted the API companies who can do data integration. I hunted for like several years. I thought that's good enough. But what I learned, maybe 90% of data has a software we can actually, without using API, we can connect it. 10% of devices we are making, and they don't have basically software. So my founder actually provide SDK, so they can actually bundle with this device. 5% is literally nobody know what it is. But that's the majority of people. These patients go home, they receive one small device showing the blood pressure and the weight. That's probably the most important data for the doctors. And they don't have a fancy devices most of the time. They take a picture. So I liked this company because they covered 100%, not 95%. I found a lot of companies who cover 90%. Probably that's good enough, but we won 100%. If you see it 360 degree, then you feel confident, oh, you can cover beyond what we want to. If you have a 90%, we have always feel like it's not good enough. We are something missing. And also patients in real life, they don't really have all the kind of fancy watch, something like that. They use the measure, and they just don't know how to use these fancy devices. So they just kind of, all they can do at least can take a picture and then send it. And these founders basically kind of consolidate all the data and then send it to the healthcare system. So this is there now. Still, we don't see that commonly. This company is very, very early phase. They are bootstrapped and all the seed round, which is very, they just kind of enter the US market. So I have a huge hope, but we need more. RPM, we have so many patients, and also we have aging population, probably need a little bit of tender care. Those is a huge market. We want to ensure that some things they can use. It's a UI, UX. They don't have any problem. They don't need to learn something new. They can just take a picture. This one is simple for them, so we actually need to help them to access to this technology in their way.
Absolutely. I want to coming back to your point around the care experience, and I'm sure you know the stats probably better than I do here, but seniors in the U.S. are supposed to get an annual cognitive screening.
Yes.
And what % is the estimate of those that get an annual cognitive screening that should? Any guesses? It's super low. It's lower than that, Galen, even lower. So
I would say 10%. Yeah, if I had to guess.
lower. Way lower. Way lower.
Like 6 to 8.
Yeah, there you go. Essentially, they're not getting them. And part of that, as you said, is this disconnected care experience. One brilliant company that we saw in the Alzheimer's space that was doing testing, going back to that for a moment, for the more developed aging population, they shifted from putting testing at a neurologist's office to putting testing at an OB-GYN.
Yep.
Because of the disproportionate effect that Alzheimer's has on women and the fact that women reliably see their OB-GYN annually versus no one that doesn't already have severe dementia is seeing a neurologist. What can tech companies do that want to access these channels and get to patients? How can they work in this very kind of fragmented care ecosystem to get the things in the hands of the people that need it?
I can take it first, and then I think you should talk about your caregiver portfolio company. But it's such an important question because I think for a long time as investors, we looked at opportunities, or we sometimes bias, I will speak for myself, I sometimes bias towards opportunities where you could go to the specialist as opposed to going to the primary care physician. When the reality is everything happens usually at the primary care doc. And you have 2 yearly appointments usually with your PCP in the US, and it may take you another 6 to 8 months, let's use Alzheimer's, to go to a specialist and get on their calendar if you're lucky, if your state has a neurologist. Out of the 50, not all of them have licensed neurologists in the state. So it becomes really important to not only think about how you're delivering this new technology to the patient, but how you're delivering it to their support systems. So this shouldn't go on record. But my parents, my chart accounts, that's me. That's not Mr. and Mrs. Walker. That's me typing in and looking at their chart and reading what happened and having a discussion with them when they have those cognitive exams that the doctor doesn't have a chance to go through because the average visit in the U.S. is 8 minutes. Mm. So there is a laundry list of things that we need to touch to get to better solutions. And to your point earlier, it's where I find the most commonality is with patients that are over 65 and for patients who are under the age of 12. And that pediatric population and the caregiver care management schemes that have to occur, you have to start to be much more creative in the messaging, what the tools look like, and where that access point is. Yeah. And I would argue that it can't be the specialty office anymore. It has to be fundamental. It has to be CVS. It has to be Walgreens. It has to be wherever your footprint goes to on a regular basis that you trust so that you can engage with the technology, but also feel comfortable with whatever information is that you're receiving back from it.
I want to hear about this portfolio company of yours, Gal. Nicole's been talking it up, so I'm ready to hear.
And I'm not an investor, but I think it's
Nah. Well, Nicole is talking about the challenges of caregiving and caregiving coordination. The portfolio company that was mentioned is Melly, in terms of we need to address the challenges of the caregiver, of the patient, and of the nurse in assisted living facilities. At the same time, there are a lot of layers here to factor in. Also, the logistic and the financial and the clinical. I think it's important to say. So they tap into the world of the coordination between the different needs of the patient, between the different caregivers, to really help you provide that better care continuously. Remember, a lot of our patients at this age are at home and they're difficult to engage. I wanna hit another point that is relevant to that in terms of the data and the infrastructure, right? When we go to a hospital, whether we go to a hospital here at Hopkins, whatnot, we have the electronic medical records. We have infrastructure that has been operating in it that is standardized for a very long time. It's very different when you go to take, for example, assisted living facilities, the SNFs, where you have a lot of patients in this age, and they don't have that EMR, and they have nurses that are tired with a lot of churn, and you need to factor in that they also need to contract with insurance companies to get that in-network physician for their patient. So when we're thinking data, we need to think about solving fragmentation to provide continuous care, the care continuum. These patients move from place to place to place, and they need us to watch them continuously.
Yeah, so I actually see now in America a lot of probably primary care givers turn to longevity clinics. So they want to approach the holistic view. They basically kind of become the doctor to care of all your family, basically. So that's going back to like 19th century, in my opinion. But anyway, the model works. So there's a lot of technology, and we build a lot of data, and then we just don't know what to do with it right now. And we are, of course, building the AI technology, and then move on to find a pattern, to find the right method. But I want to go back to the caregiver problem. So there will be, by 2030, we expect the aging, all anti-aging, all therapeutic, all this kind of senior care, market size will be $65 trillion. In that big market, as a matter of fact, do you know how much is a caregiver actually take a portion? About 40% is caregiver. It's amazing. It's huge, because labor is expensive, especially in the United States. Labor is super expensive, and these are not just laborers. These are trained, special labor. My solution, what I'm dreaming about is, I actually entered a company called Figure AI. It's a most advanced humanoid robot technology in Sunnyvale, San Francisco Bay Area. And they are, of course, not going to the caregiver direction yet, but they actually be able to use it for the future in the households. They can, we don't want to have a camera, but they have sensors in the humanoid robot, and they can scan. If there's in any emergency occur, they can notify to the a caregiver or the hospital or the 911. They have that kind of function, and they can actually help people to walk if they have a little bit difficulties. So I actually see robotics will play a lot of role. Of course, we need to have a human touch. It's compassionate kind of human be there, but as you mentioned, the caregivers are tired. There are so many unnecessary chores they need to do, and then they're so concerned if it's, their mom and dad fall in the bathroom, and that's a huge problem from the dehydration, and very, very common problem too. So when you have this kind of robots, and they can be free themselves, they can go out, they walk, but they can still monitor what's going on inside of the house. And we really see that will happen. Not just need to be a humanoid form, but humanoid could be easy because you can go together. But I will talk about a lot of sensors and a lot of the technology we can actually help to monitor this aging population and patients as well.
Yeah. Let's think about, oh, please, go.
No, I was just going to say, you make a really good point, and maybe it's something that I've thought more recently is we talk a lot during the development process for a lot of these products of talking to the clinicians and even talking to nurses, but the caregiver population is an untapped resource, and they see so much. I mean, they go into homes 3 times a day, 7 days a week, and have a true perspective on what it is for a family to deal with some of these problems up close and personal. And even in my experience, I used our caregivers to help give me insights of where to find tricks and where to find resources because they had seen it so many times. So I would say that's another opportunity for entrepreneurs to really think about how do you tap into that memory source, just given the large variety of it.
Yeah. I like the conversation around the kind of the future technologies that we could see in this space that'd be valuable. And let's talk about kind of the technology of the moment, AI. We'll tap into to some of the expertise here. You see right now, you talk about workforce shortages and labor issues, AI being pitched as a really, elegant solution in certain areas to augment human labor. Opportunities like AI-assisted diagnostics all the way over to having a AI personalized caregiver that mimics your behavior for your parent. These are all ideas that are being floated. Is this realistic? Is this where we're going? What are we going to see with respect to AI and age tech, both for the younger population that's aging and for the already aging population that are facing some of the larger issues that come with that?
So in terms of AI technology, of course, AI cannot depart from the machine learning, the big data. I actually talked to the AI infrastructure session that we should go to prevention from the reaction. With all the data we built, now we can identify where the real root cause is. And with that data, we can actually start to build a complete reset our drug development or therapeutic development. And then we actually set up all the infrastructure there. One company, our portfolio company is actually they're using ML technology. They liquid biopsy company, but they actually were able to find the cancer, lung cancer from the blood 4 years advanced than standard care. Actually, even before the tumor forms, from the biomarker they identified in the blood, they can find this person has a high probability to grow lung cancer tumor, so you can monitor. So before onset starts, and also another company, Snaptica, one of my favorite company, they actually using RTMS EEG technology, and they do the cognitive electrophysiology stimulation. Their dream is to kind of slow down the onset of Alzheimer, and they luckily they made a huge progress. And eventually, you start early like 40s, and eventually you don't have onset of Alzheimer at the end. So you can kind of get rid of Alzheimer in the future. Maybe that's too...
No, it makes sense. There's a lot of vision there.
Too aggressive or too huge a dream, but can be possible.
Yeah. Gal, I want to reframe the question slightly for you. When we heard Soyoung talk a little bit about the idea of shifting to prevention, it's no secret. Today, there's no money in prevention, right? Who gets paid on that? When you think about some of what we're seeing with big tech enter the space, right? You see Pronovo, whole body scanning. You see Daniel Ek from Spotify just launched his whole body scanning. The system could not possibly support doing diagnostic testing on everyone from age 25 for the rest of their lives. How do we solve this care paradigm? You talked a little bit about value-based care in previous areas and some of the challenges and headwinds with adoption there. Take us through how we should be thinking about the care paradigms, the payment paradigms, and how we're going to shift that in order to get age tech, make it a reality for people when they need it.
I think first and foremost, when we're talking about this age, over 65 and focusing on the U.S. as our primary market, this is government-owned insurance. Medicare that is growing. There is a fast-growing aging population that sits under Medicare, and they're incentivized for you to do better. One of the reasons why historically prevention wasn't a big thing was not only because of engagement, but because when you're below 65 and you have private insurance and you switch it every 2 years, 3 years, you don't have any sentiment to your carrier, then it's not worth it for them to think about where you will be in terms of diabetes or Alzheimer in 20 years. They don't care. It's not on their, it's not on their charts and their costs, and that's the truth. And when we're shifting to have a lot more people under Medicare, we understand that they are incentivized to take care and reduce these costs, these dramatic costs. And so the main question is not do they want to, but can they? And when we try to understand if they can, then we know that it also sits underneath the data, because when we provide them with an accurate and full comprehensive picture of these patients wherever they are, then we will be able to improve their outcomes. But we must provide that complete data, whether it's well-being, whether it's clinical symptoms or whatnot. And so shifting to value-based care, I think more and more is becoming a reality. And then you just need to think, okay, when we're saying that, do we have enough tools and do we connect this ecosystem well enough for it to be executed?
And that is really I believe, the cornerstone challenge within our U.S. healthcare system right now, this push and pull between the payers and trying to drive towards more value-based populations under their coverage, and the health systems, and trying to manage very narrow profit margins. I mean, most health systems in the U.S. are sub 5%. Mm-hmm. If that were a Fortune 100 company, there would be mad board uprisings within each of those corporations. But that's the reality of the economics of our care. So if we are driving to a value-based system where you assign a total product of services at a certain cost for a patient, how do you get there? How do you decide the cost for someone who hasn't been diagnosed with anything until June, when they were assigned a cost value in January? And I don't think that, at least as a product developer, I thought through enough of that when thinking about the market access strategy and what the headwinds would probably be. But this idea that we can get there, it's just how do we unlock that data and make it a tool set? The VA, I don't get paid by them, I think is a really good example, because they are using their longitudinal data set and assigning a value for each of their patients and starting them early, of saying, we know that you've come to us with these symptoms at 45. You have a high probability of ending up here by the time you're 80. So let's start now. We're going to put you in a cohort of patients that we manage more aggressively. We're going to automatically assign you to... I think there's a whole thinking around it. Imagine if we did that with every health system, that with every payer in our structure, but everyone sits in their own silo with their own P&L. It's much more challenging to do that, right? I think you can if there are data sets that you can tap into and really understand how much your population is really charging you, and then build care packages around them under the values plan structure that is different from fee for services, where you don't have that same incentive.
I have to add something to Nicole, if I may. I think it's important. It's connecting to the company we mentioned before with the virtual first primary care for Medicare Advantage. It's the value-based. They have one physician tapping into a panel of thousands of patients. Then they have health promoters. Then they have nurses. Then they have dietitians. And so we have someone watching the patient all the time, but we don't let the physician do tasks that are using their time. And that is one of the key elements to really being able to execute on these value-based care programs, which is, okay, We know that 35% of healthcare is potentially automatable by AI. We know we're missing these people. But is everyone really practicing at the top of their license? For it to become a reality, we have to utilize all the different types of the healthcare workers. So we'll have that better picture of our patients, and then we'll see the result.
Yeah. One subset of people that really want in on this space are the big tech companies. You can see what Apple's doing already, whether it's moving their their AirPods to clinical grade hearing aids, the partnership they had with Biogen Digital Health, which when Biogen folded that division, that partnership ended, but it was a smartphone-based cognitive screening that they were looking at for Alzheimer's. They clearly are pursuing, and you mentioned access to data sets. They've got them because they've got us all as consumers. Is the complexity that you were referencing around the system going to be too much for them to actually have an impact in this space, or is fresh consumer tech from that perspective what we need in order to bypass some of these systems and get technology in the hands of patients from those that understand how to get compelling technology in the hands of people and then work backwards? And Soyoung, I'll start with you.
Yeah, so it's a kind of a DTC sector. I'm not huge in the consumer sector, but DTC is a huge trend. Now, before we focus on payers, but think about that. Baby boomers, turn to 65 by 2030, all of them. Do you guess the Medicare cost forecast? Only Medicare, $260 billion. It's all tax money. Can our younger generation afford it? Maybe a little bit tough. Maybe or AI. Maybe AI make money, so they can afford it. But still, it's a huge economic burden. Big tech, now I see that this is a huge market. They probably acknowledge it. I met once the VP of Google Health long time ago, and then I asked him, he's a medical doctor, what are you doing at Google? You're a physician. And he said, oh, I go out and then collect data. We go out, ask people, are you agree to share data with us? So they started that a long time ago before pandemic, of course. But I went to a small event, DeepMind at Palo Alto. They said, oh, we're going to have imaging data set. We'll start collecting all the image data and provide you. DeepMind is part of Google, but Google recently released the news that we were going to collect all the voice. And then from the voice, I can understand if you are sick or not, what kind of disease you have. So those big techs enter it. The interesting thing is they have no idea what they are doing. They just collect data. But they have already a lot of data. They said they were going to collect data means they will literally collect a lot, huge data. I like to, as a more startup, of course, I think we need to understand what they are looking for and then provide very specific, very valuable data. They cannot even get it by themselves. I would think it's a good thing, but at least big tech companies' interest in this sector. They will provide a lot of devices. They will try it. A lot of them will fail, and that's how they basically operate. They try and then fail. Okay, I move on to the next one. But because they fail, there's an opportunity for us, experts who knows this medical device, who knows the data, health, IT. There's the opportunity we can have. Hey, I know you struggle. Here we are. We actually built amazing, really, really clean data for you. I believe they will be very happy to see that, and they want to find a way how they can actually monetize it.
Their participation, they certainly comes with a lot of capital and a lot of experimentation. And that could be, as you said, it could have impact, but it also could create, inroads or paths for more companies to do similar things with more targeted expertise.
But I will say that, and maybe this is slightly contrarian to your view, when I was a medical device engineer, we thought of ourselves more along the consumer aspect because diabetes devices, oftentimes we'd have to market directly to the customer. And so we ended up hiring in more people who had traditional consumer packaged goods talent, especially on the marketing side, to feed back into the design, because that idea of having a strong idea or a strong knowledge set of customer delight is something that they bring to the table that I think we need more so of, especially as we think about med tech within healthcare. But I think the clashing of those two worlds is actually a good thing, because they have the access to how consumers think about interacting with the widget, and they're on the phone and getting the hard questions all the time. Whereas we're thinking in the back of our minds, well, how do you demonstrate a clinical trial? And how do we get that through the FDA? If you can put those two brains together, or better yet, build up that brain through exposed assignments in a given corporation. And I think what we did at Abbott with designing that sensor that went on to be the Libre continuous glucose monitoring sensor, which is now having a direct-to-consumer, over-the-counter full push behind it, is just one example of what you can do if you step outside the box and say, I don't want to think of myself as pure med tech. I want to think of myself as a consumer device that can provide clinical and wellness insights. And how would I change my to-do list on a given day to get there? But I agree with you. I don't think that as a technologist, you just walk into a hospital and say, hey, I have this cool AI software for you. Let's go. That's not how it works unless you can really articulate the understanding of not only the need, but the pain that they will need to go through for that adoption, which it may be worth the pain, but you're still talking about someone who's done something for the past 30 years and has a clinical kind of knowledge and thoughtfulness behind it that they just can't move from with a new addition.
Yeah, we'll wrap up on this question with some final thoughts, but all of these things that we're talking about, presenting the opportunities, understanding the challenges, I think the kind of thing to bring it all together, how do we get more capital into this space? And how do we make some of these ideas a reality, advance the companies that you've already invested in, finance new companies across devices and even outside in health tech and IT, consumer, biotech? How do we get more capital into AgeTech? Gal, we'll start with you and wrap up with the final thoughts on that.
Yeah, I think one key player that AgeTech is important to specifically our pension funds, pension plans. When we're thinking AgeTech, we need to think also of financial stress and not only physical stress. And people are in the mindset of preparing for the next phase of their life, preparing for managing their health beforehand. Think also of long-term care insurance. I think one of the ways to get more players there is just identifying those players that have relatively low rates of engagement, don't know enough about their members, care about it because they pay for it later on, and then really drive them into the innovation ecosystem.
Yeah, my thought is, I really want to ask founders find out what is your real special value. So there's a lot of needs. Probably something is not really transformative, but some will be really beneficial for the patients or elderly people, or even the caregiver. So I want you to bring that special value to the society. And also at the same time, I want you to think about what is the biggest problem we are dealing with and how can I make the biggest impact on this society? I'd like to ask you to think about that.
And I'd say definitely the pensions, but also a number of the associations as you think through how this technology is being provided, whether it's something for Alzheimer's and the Alzheimer's Association or the dementia funds that have established themselves, each of these verticals that focus on a specific population, even women's health, because I would argue that since most of the dollars within a household are usually distributed by the woman, and the mandates around healthcare are usually driven by the female spouse, that women's health in this aspect of how you maintain mental health for women here is really, really important because it's not so much the waiting. A lot of times it's here. And so you are dealing with an aging parent and you're dealing with the care of your family and trying to think about yourself. So being able to tap into some of those associations, the Diabetes Association, as an entrepreneur, each of them who have small funds but have more of a mission and a passion around finding solutions for their constituency, I think is an opportunity that we don't tap into enough.
Well, awesome. We are at time. Thank you so much for this panel. I hope that everyone in the audience found it valuable, and I think that considering everyone here is going to age besides me, it will be good to understand the future of this space, and for those companies out there who are interested in the age tech space, definitely talk to these three after the panel. Thank you so much.